Welcome, everyone. In this explainer, we're going to tackle the most important map you'll ever use in your career. We're going to turn these sometimes tricky anatomical concepts into the real-world practical skills you need, not just to ace your exams, but to become a safe and super confident professional.
So let's kick things off with a question that really gets to the core of what you do. It's about a system you're going to have to navigate successfully every single day with every single patient you see.
And yep, you guessed it, it's the vascular system. But look, knowing this network inside and out, it's not just about finding a vein. It's about understanding the whole terrain so you can avoid hazards. Honestly, this is the key to preventing complications, keeping your patients safe, and protecting the integrity of every single sample you collect.
All right, let's start with the big picture, the blueprint of our vascular system. You know, just like with any map, if you understand the main highways first, it makes it so much easier to find the specific little streets you need later on.
This system is just a massive closed-loop network. And get this, if you could actually lay it all out end to end, it would stretch for about 60,000 miles. Insane, right? But luckily for us, this huge network is organized really neatly into two main circuits that you absolutely have to know for your exam. So think of it this way. The pulmonary circuit, that's the quick trip to the lungs and back again to pick up oxygen. Then you have the systemic circuit. That's the massive delivery route, taking all that fresh, oxygenated blood out to every single tissue in the body. They work together in this continuous loop, but their different jobs mean the blood you're collecting has different qualities depending on where you are on the map.
Okay, now let's zoom in on the different types of roads on our map, the vessels themselves. We're going to focus on the practical differences between arteries and veins that are just absolutely crucial for the work you'll be doing.
Think of arteries like these high-pressure superhighways carrying blood away from the heart. They're thick, they're muscular, and you can feel that pulse. Veins, on the other hand, they're more like the low-pressure country roads bringing everything back home. They're thinner, they can collapse, and they have these neat one-way valves. These differences are exactly why we choose veins for blood collection. It's just so much safer and more effective.
Okay, everyone, listen up. Put a star next to this one in your notes. This is a classic exam question, and it trips up so many people. The rule is simple but critical. Vessels are named for their direction of travel from the heart, not by how much oxygen they have. That's why the pulmonary artery carries deoxygenated blood away from the heart, and the pulmonary vein carries fresh oxygenated blood toward it. You have to burn that into your brain.
Now, let's zoom in even further to our prime location, the antecubital fossa, or the AC for short. This is where you'll be working most of the time, so let's really map this area out.
This little bend in the arm, this is your go-to spot. Why? Well, the veins here are usually nice and large, they're close to the surface, and they don't tend to roll around as much, which is perfect for us. But you need to know that the veins here can show up in two common patterns.
So most people have what's called an H pattern, which you can see on the left. Others have an M pattern, there on the right. But here's the key. You can't just look. You have to palpate. That means feeling with your fingers. It's the only way to really know which pattern your patient has and to select the best and safest vein to use. So here's a really crucial point. You don't just get to pick whichever vein looks good to you. Nope. There is a strict safety first order of preference you have to follow every time. This isn't just a suggestion, it's the standard of care.
And here it is, your hierarchy. First choice, always, is the median cubital or median vein. If you can't use that one, your second choice is the cephalic vein. And your third and absolute last choice in this area is the basilic vein. Now, let's break down exactly why we follow this specific order.
This slide shows you the risk assessment you're doing in your head every time. The median cubital is choice number 1. It's anchored, it's safe. The cephalic is a good backup, but look at the basilic vein. It is your last resort for a very, very good reason. It's sitting right on top of the brachial artery and the median nerve. A mistake here isn't just a mistake. It can cause serious, permanent damage to your patient.
Okay, but what happens when the AC fossa just isn't working out? You know, sometimes veins are scarred or maybe bruised, or you just can't feel them. So let's cover the rules for these difficult draws and talk about the sites that are absolutely off limits.
So your main backup location is the back of the hand. But listen, the veins here are smaller and they're more fragile, so you've got to switch up your technique. You'll probably use a butterfly needle and tubes with a lower vacuum so you don't collapse the vein.
Think of this table as your absolute safety Bible. You have to know this.
Dorsal hand veins? Okay, but be careful. Leg, ankle, and foot veins, that's a hard stop. You can only use them if you have a doctor's documented permission, because the risk of causing blood clots is really high. And the palm side of the wrist, forget about it. It's a total no-go zone, packed with nerves and arteries. The risk is just way too high. Now for probably the most important safety check you will ever make. You're feeling for a vessel, you think you found a good one. What is the one red flag, the one sign that tells you to stop right now and find a different spot? The answer? A pulse. If you feel that little thump-thump under your finger, you're on an artery, not a vein. And you stop. Immediately. No exceptions. Going forward is a huge risk for the patient, and it's a critical error on your exam and in real life.
So this brings us to our final section, and it really ties everything we've talked about together, because every single step we've discussed is designed to do two things at once: protect your patient and protect the quality of their test results.
So let's just run through the fundamentals, okay? Think of this as your mental checklist for every single draw. You always palpate to check for a pulse. You avoid any spots that are bruised, scarred, or have an IV. You watch that tourniquet time, no more than 1 minute. And you always activate your safety device and label your tubes right there at the bedside. These are the absolute pillars of safe phlebotomy.
And remember, your technique directly affects the test results. Following the correct order of draw prevents additives from one tube messing up the test in another. That light blue top for coagulation studies, it has to be filled perfectly to that line or the lab will just reject it. And if you don't mix the tubes correctly, you can cause tiny clots that ruin the sample. Your skill is what protects the quality of that specimen.
So let's end with this thought. Mastering this vascular map isn't just about passing a test. Every single tube you draw holds a piece of a patient's health story. Your knowledge, your skill, and your attention to detail, that's what protects that story and makes sure it's told accurately. And that is the profound responsibility and the privilege of being a phlebotomist.